The Apollo Infant Dynamic Mattress is a dual therapy dynamic pressure mattress replacement with a 1 in 2 cell cycle system. It is for single patient use. The maximum patient weight is 60 kilograms, which is 9.5 stone. It is used for patients with a physical size of less than 75 centimetres. Clinical judgment should be used to determine suitability. A lower or upper age limit is not defined, as it depends on the physical size of the patient in relation to the proportions of the mattress and the bed frame. A risk assessment must be performed to ensure the suitability of the patient. For example, unstable spinal injury or fracture, cervical or skeletal traction, and neonates. The mattress is intended for a cot frame which has a platform of approximately a length of 132.5 centimetres and a width of 68 centimetres. The umbilical cord is at the foot end with the print on the top of the cover facing upwards. The control unit fits on the footboard of the cot or on a firm surface. Attach the air connector tube to the control unit. Check there are no kinks or trap parts in the cot frame. The mains cable must not be routed near to or along the length of the mattress due to a risk of strangulation. Route the cable away from the mattress and the moving parts of the cot frame. Ensure you do not create a trip hazard. Attach the pump power lead to the socket and switch the pump on. On inflation, the 5 pressure settings will flash blue and a short audible alarm will sound until the mattress is calibrated. Once the pressure settings have stopped flashing and it has defaulted to the level 3, the mattress is ready to use. This takes up to 45 minutes. Ensure there are no sharp objects in the vicinity of the mattress. Secure sheets loosely enough to ensure they do not interfere with cell alternation. The Apollo Infant is made up of 19 air cells which sit within a foam structure. This creates an 8 cm foam border around the edge of the mattress as highlighted. Clinical judgment is to be used to determine the patient is positioned appropriately on the air cells. The mattress cover is multi-stretch, water resistant, vapour permeable and has a high frequency welded seam. There is also a fully concealed zip which reduces the possibility of fluid ingress and aids infection control. The mattress has a white inner substrate on the underside of the cover which helps auditing procedures by making staining easy to identify if the cover has been compromised. The 1 in 2 cell cycle over a 10-minute period ensures that 50% of the patient's contact area is supported, whilst the other 50% has optimum pressure relief. The controls on the digital pump are the on and off switch, the low pressure indicator, power failure indicator, system ready indicator, the surface type, which has a therapy choice of alternating and constant low pressure, max inflate, comfort control, lock and unlock function, and the alarm mute. Patients can be nursed on the mattress in both alternating mode and constant low pressure. Constant low pressure may be selected for short intervals if the patient is finding it difficult to tolerate the alternating mode. The mattress automatically defaults to alternating mode when it is switched on. To change the therapy mode, press the desired button and a blue light will illuminate to show which one is in use. Max inflate mode should be selected for personal care and nursing procedures. When the max inflate is selected, after 20 minutes the system automatically reverts back to alternating therapy and level 3 in the comfort setting. This is a safety mechanism to ensure patients are not left on an overinflated surface. To change the comfort range, use your clinical judgment when changing the pressure settings. Press the button to increase or decrease the pressure. There are 5 available pressure settings, level 1 being soft, which is 10 millimeters of mercury, level 2 being 15 millimeters of mercury, level 3 being 20 millimeters of mercury, level 4 being 25 millimeters of mercury, and level 5, which is firm, being 30 millimeters of mercury. The blue light indicates which of these settings is operational. Should the pump be turned off for any reason, it will always return to its default setting of step 3, which is 20 millimeters of mercury. The control unit locks out after 2 minutes of inactivity. To unlock, press the lock button for 3 seconds, press again for 3 seconds to relock, otherwise the lock will automatically relock. A blue light illuminates when the system is locked. The mute function silences the audible alarm. The audible alarm sounds if the power is switched off, or if there is a power failure, or if there is low pressure in the system. This will re-alarm after 20 minutes if the cause is unresolved. Press the alarm mute to silence. Switch modes from alternating to constant low pressure and wait for all cells to inflate before transporting the patient. Remove the air connector from the control unit, seal with the attached transport cap, turn off the control unit and disconnect from the power supply. The mattress stays inflated for up to 8 hours in normal conditions. Rapid deflation of the mattress may be required for emergency treatment or system deflation. In an emergency or to deflate rapidly, disconnect the air connector from the pump. A low pressure alarm will sound and the indicator will illuminate. Reattach the air connector to re-inflate. Wait for the mattress system to reach optimal pressure prior to a return to normal use. Once re-inflated, ensure the correct settings are reselected. Continence products can be used, however the mattress performance may be compromised due to the reduced effectiveness of alternating pressure redistribution.